The healthcare market is currently undergoing a dramatic change, as we can see this, because financial pressure is increasing. And we see this not only in Europe and in North America, but all over the world. You need to have a more efficient and more effective treatment. And a more efficient and effective treatment is not only caused by pharmaceuticals or the treatment method, but one of the key factors is the well-being of the patient. So if you have, for instance, patient rooms, if you have intensive care units, but also patient preparation areas, operating rooms, which gives you a pleasant and a nice atmosphere, then you can already reduce the amount of sedation you need for sedating the patient, which will cause later on a shorter rehabilitation time. And also later on in the rehabilitation, if you have a good environment, which is supporting the rehabilitation of the patient to bring him back into the day and night shift, to get him back in a normal track, will dramatically improve the medical and clinical outcome. And this is a trend we can see worldwide coming up, and also in the Middle East, especially here in the Middle East, where we have very special disease patterns which are in the Middle East only. The emerging markets are for us currently especially China and India, which is very booming. Also we have South America, which is growing dramatically. And it's very good for us because they have not invested a lot into the healthcare sector over the last years. Also they do now have a high growth in population and a booming economy. So this will lead them also to clearly improve the healthcare facility for their employees, but also for their well-being of the whole population, because this is one of the main services you need to provide to have a sustainable growth in your country.
How are healthcare delivery models changing in response to new developments in digital health?
Digital health is also a very big trend, because what you see in your daily life, you have an iPhone, a BlackBerry or a Samsung telephone, so you are connecting with the world. Same thing is happening in a modern operating room today. You want to be able to change instantly in real time medical images from your endoscope, from your microscope, or from a room camera to your colleague within the same hospital or to your colleague in another country. Because then you can do consultation also online in an audio-video conferencing. You can improve the medical outcome by this to get more specialists, more people involved into your procedures. And also it's a big trend that you need to document your cases very properly, especially in times of insurance companies, which want to make sure that the treatment was done properly. And then you can document your cases with audio, video, and medical records, patient data, patient pictures, very nicely in the modern PACS, HIS and RIS environment.
Which areas of healthcare do you think investors will be interested in?
Investors are now looking forward for building state-of-the-art intensive care units and isolation rooms. Especially we see a coming threat from global diseases here in the Middle East. I think MERS coronavirus is very well known to everybody, but still also tuberculosis is something which is not off the record yet. It's a very active and aggressively growing virus infection, and Ebola has also just recently proven in West Africa that you can have very fast growing infections and diseases in a region. So you need to make sure that you can isolate these patients at a very early stage. At the same time, you need to make sure that you can protect your healthcare staff. For this reason also, we have developed together with the World Health Organization an isolating room concept, which you can install on a very quick, very fast track system everywhere around the world. It's in a modular prefabricated concept. And at the same time, you will get the same clinical and technical outcome like it would be in a fixed hospital somewhere in Dubai or in Tokyo or in New York.
And finally, how has your overall experience been?
The hospital build is for us one of the major and most important events, especially here in the Middle East, because we want to connect with architects, engineers and planners. With our solutions from HT Group, we are very early involved into the projects. So we need to be in the first design phase, in the first planning phase involved, which will allow you later on to cut the cost, to avoid unnecessary surprises, and at the same time get state-of-the-art healthcare delivery in your hospital.
It's a wrap.
I'm done?
That's the last one.
Okay.
Thank you.
Thank you.